We are inside the COVID ward, and with me is Dr. Peter Roloff. It's been through 2020, now 2021, the second wave.
Yeah.
We're experiencing this with you, and we're seeing the work that you are doing. It's caring for patients, it's looking after them. And you're going to take me through the ward, so we're going to be talking and showing how it is to save their lives, to look after their health and their well-being.
Yeah. Yeah, it's been difficult now in the past month. The second wave is much worse than the first wave. We see people becoming sicker earlier, and they become more sick. And everybody lying in here needs oxygen, okay? And they don't only need normal nasal prongs. The majority, I would say 90% of people in here is on normal nasal oxygen, and they're on a face mask with a reservoir where they rebreathe the oxygen. So they need much higher concentrations of oxygen because they become so short of breath. So it is frightening, to say the least. It's completely different, and I'm feeling for everybody. I'm feeling specifically for the healthcare workers, these nurses that's been working here for more than a year. They're doing double shifts the whole time because we just can't get hold of personnel. People are tired, so it's been very difficult.
And now we are going to go with Dr. Peter Roloff. He's going to show me a patient who's on a ventilator. We're also going to show x-rays of how someone's lungs look who has COVID and not COVID, so you can see the difference. And also, I'm in a hazmat suit, and to breathe in it is struggling, and yet there are nursing staff who's doing this for 12 hours a day.
12-hour shifts, yes, yes. I actually just want to show you a young guy who's 38 years old, who's been here for 10 days now, and he's been on the ventilator now for 2 days. And this is just an example of what happens with COVID. You know, unfortunately, you can't predict who will end up on ventilators, but people believe you're only supposed to be older and have a lot of comorbid conditions to end up on a ventilator, and that's not the truth. We do see a lot of young people now getting sick, and we do see young people on ventilators like this gentleman, and it's really scary to see.
We've arrived inside the ward. I'm with Dr. Roloff. We were talking about just showing someone's x-ray when they have COVID, so you can see the difference, because people still believe that COVID is not real. Doc, let's just talk about this patient and show the x-ray.
Okay, so what I just first want to say is this gentleman is on a ventilator now. He's 37 years old. He came in on the 3rd of January and it was tested for COVID positive now. And I don't know, it's not always that easy to see, but you see the whole lung has become white now. Okay? It's supposed to be black. Initially there was white dots everywhere, so it's become more white. Okay, and that just means that the disease has progressed, and you get something called ARDS, which is just a complication of a pneumonia, and that is what's happened here. So we were forced to intubate and ventilate him, you know. So he's currently day 3 on the ventilator, as only 37 years old. And he's doing okay, but it's early days. He's been in hospital now for 10 days. So this is the end result of somebody who was admitted with COVID, who was a young guy. And this is what COVID does to you. Okay. So COVID can affect everybody. It doesn't only affect older people. I think it's a very important message here.
Now we are continuing our journey within the COVID ward with Dr. Peter Roloff. We just saw the patient who's 37 years old, and Dr. Roloff was telling me your normal oxygen level is 10 and above, depending on your health, depending on your age. Dr. Roloff, we got one patient, 37 years old, doesn't smoke, and he came in last night, oxygen level at 6.
Yeah, 6.8. And he's newly diagnosed with a COVID pneumonia. He's one of our essential essential service people, policemen, without any comorbid conditions, no hypertension, no diabetes, and only 37-year-old. And he was profoundly hypoxic, and that means that his oxygen content in his blood was less than 10. But 6.8 is really bad. And he required oxygen overnight. He's getting a rebreathing mask and he's also getting BiPAP to help him. He looks much better this morning, but last night he was very sick.
Well, as I said, we are talking to the patient, Mr. February. Aldridge, you are a policeman, 37 years old, no smoking. You came in to Melomed because you couldn't breathe and your head was spinning.
Yeah, that's correct, yeah. And I was about to, for me I thought my time is finished on earth. So my last option was to come to Melomed.
You came to Melomed and you're in the hands of Dr. Peter Roloff, sir. Just your experience right now, thinking that it could be your last, and today you're sitting, feeling healthier, and it must be a relief for you.
It's a great relief for me, my family, my wife. I've heard about Dr. Roloff, sir. It's not my first time at Melomed. It was for an operation. And I've heard about Dr. Roloff, sir. Very good specialist. And I know I'm in good hands when I came to Melomed.
All right, just lastly, I've got to ask you this, Aldridge. What message do you have for anybody out there? We are experiencing the second wave. It's way different to the first wave, and our specialists, our doctors, our nursing staff are looking after patients. What message do you have for people out there?
I'd just like to say that it's a reality. And some people, they still take it for granted. As South African whole, they don't see the how can I say, the seriousness of this illness, and it is death. And if you don't look after yourself and protect yourself, then it's your last. But for me, I'm in very, very good hands, and I'm so glad I came here.
Well, there we go. We took you inside the COVID ward, ICU, an experience that you've seen our nursing staff and doctors taking care of our patients. As we know, the second wave we are currently experiencing within South Africa, and we want you to take care of yourself and take care of your health. As you've seen, our nursing staff, our frontline staff, our doctors working tirelessly around the clock to look after our patients. Once again, from all of us at Melomed, we want you to take care of yourself, wash your hands, sanitize, wear a mask, and practice social distancing. Take care of yourself, take care of your loved ones, and until next time, goodbye.